Narrows is a community that is fairly remote. It's difficult to get to. The nearest center is actually Flin Flon, which is over on the Manitoba side. So, and it is a First Nations community.
People would travel in sometimes 6, 8 or more hours from all over the province for a 1-hour visit. And we both felt there must be a better way to do this. And we were sending them back to their home communities without necessarily lots of support in the community for the type of treatment we were recommending in terms of non-surgical or non-medical management.
I've always been a very strong advocate for people to be able to get access to treatment for a variety of health conditions. But as a clinician working with our communities, you really get a great sense of how little access there is for people.
We had an opportunity to see 2 First Nations women who traveled 12 and 7 hours respectively to see us in the clinic. On that particular day, it was end of December, almost 40 below and blizzarding. And they had traveled that distance, and incredibly their bus was leaving before the end of our appointments. So it would be a 2 or 3 day commitment for them away from their communities and families to attend the visits. And we noted at that point that a lot of the questions and considerations could have been made over a telehealth model to ensure better access to faster services for them, for the team care that they needed. So that's when the projects began. Mm-hmm.
When you're over the telephone, as the physician on the other end can't see the patient, they have to go by your eyes and ears. So it has really given us that benefit so that the other person on the other end of the telehealth is able to physically see and do some primary assessments along with the staff. The same is with the physiotherapy. The physiotherapist can see the patient, they can watch what they're doing, they can guide, with me in this case, guide me through different treatments or movements to do with the patient. So yeah, so that's been a huge benefit, I find.
He says it's amazing because he can talk and he walks. Drives around, yeah, it's amazing. He said he's laughing about it.
So we're learning how to use technology that's already out there, but frankly is really underused for a variety of reasons. So how can we make better use of technology like remote presence robotics and other telehealth technology to provide care closer to the community? Not only how can we provide care, but how can we provide care in a way that's meaningful to community members and that's culturally responsive, especially in an Indigenous context?
I think that is another piece that's really important as well, being able to make sure that we're culturally safe and that we are not imposing ourselves onto people, but rather getting to learn and getting to hear from the people. So having the patient really be the center and guiding everything, not only what is the question, how do you want to approach this, what do you think is going to be useful, how do you want to use this information, because at the end of the day, this is their information. So it shouldn't be about me as a researcher becoming an expert. It's the people who are already the experts, and we should not be misappropriating the knowledge either. We need to really respect that, and I think we're seeing more of a turn to that way, and I really appreciate that. I think that's really very important, but also a really good thing to see for sure.
He said it would benefit the community to have more knowledge of things that will help them, and in the long run have a healthier lifestyle.